who works at a pharmacy here in Amsterdam Southeast. She's obviously a health and a pharmaceutical worker. So I would like to say welcome to Miss Sulisa. Please say hello to our listeners and introduce yourself.
Yes, good morning. My name is Sulisa Matthews, and I'm very honored to be here to give information and advice how to use the medication properly.
Yes.
Okay, your English is fine, very good. What would you consider to be medication abuse?
For example, in a pharmacy, you can see when people come late to pick up their medication, or they are too early. So
late or too early, what does that mean?
That means that the computer gives a signal that they are not using it correctly, because in the computer it's also saying that you use it in the morning and in the evening. And if you're not using twice a day, like is recommended, then you will be early or too late. Because the computer gives also the final date when it is finished.
Okay.
Oh.
Okay, so you can track. So when somebody comes to collect some more medication, you can tell whether the person is underusing it or overusing it.
Yes, sometimes we think, okay, they went to another pharmacy. So that's the moment we take time to ask some questions. Like the first question can be that how is the effects of the medication? Do you have side effects? Is it difficult to use them? And by asking more questions, you will know also if people are really using them correctly.
Okay. Well, as we proceed, listeners, we welcome you to give your remarks or questions to Miss Matthews. She's more than willing to answer any questions or remarks. You take any remarks that you might have this morning. Okay. So. Based on your experience, in which kind of medications do people tend to abuse? From what you have seen, like you just described, some people, either they overuse it or underuse it. Can you tell us something about that?
Yeah, there is situations like when they go to the doctor. And the first moment being aware of using your medication is when you're sitting at the doctor. That's the moment the doctor will tell you what you will use and why. And at the moment you have to be very conscious why is this treatment important. And some people just go to the doctor and the doctor prescribes something and they take it, but they don't ask questions. They don't ask what I have or why I need to use this thing. If it's not important for you at that moment, when you come to the pharmacy, you pick up the drugs and you go home, and when you feel better, you don't use them. When you feel worse, you use them. But that's not the way to use medication. Like when you have blood pressure, diabetes, asthma, those are kind of medication that you have to use every day. It's not something that when you use it one time you are cured.
Wow.
And most of people think that when I use it today, if I feel better, I don't need to use it. I stop.
But is it not that there is the idea that medication, if you put chemicals in your body, it has some effect on your body.
Yes.
So people I think sometimes are concerned about that aspect of the other side effects of medication. And so once they feel better, they want to stop. That is the thinking, I believe.
Yes, that's
is that a good
exactly
thinking?
the way. That's not the right way to think, because because of the effect in the body, that's why you're using them. There is some organ in the body are not functioning very well, so that medication replaces that function. So yes, some medication have side effects. But those side effects, when you feel them, that you're supposed to tell the doctor about them, because he can change the medication for you. So it is important to just take them every day. And there is some medication that will cure you, like an antibiotic. When you have a bacteria, you use an antibiotic, we tell you have to finish it. You have to finish it because the strongest bacteria will die at the last moment. So if you don't finish it, the bacteria will overcome the medication. Then next time when you have to use it, it will not work.
Wow.
So there's some medication that you use to cure you. That's antibiotics.
Yes.
But there is other medication that you have to take it for your whole life. And that is every day. And you're not supposed to skip. Like if they tell you to use it in the morning, then there is a reason why.
You have to use it
in the morning. And some medication is only in the evening. Like example, when you have cholesterol, those medications you take them in the evening. When you have allergic tablets, it's better to take them in the evening because in the morning the body is system already prepared for every attack. So it is not like when you feel better you stop. You have to be in talk to your doctor about the treatment.
Yes.
You go today. For example, you go today to the doctor, you find out you have diabetes. So then what you do is he give you a treatment. In the first 15 days, when people come to the pharmacy, they see also it's only for 50 days. Why 15 days? Most of the time they want more, and then they have to come back, wait in the line, you know. But the 15 days is just for the body to see if the body is okay with the treatment. And then you go back to the doctor, and he will check your blood again. And then he will see if it's, the treatment is a good treatment with this kind of medication, or if he have to give you another medication. And then you go back, and he give you another medication. But sometimes people are already using medication for diabetic, and because they're not using it properly, they get another medication because when they went back to the doctor, they didn't tell the doctor that they didn't use it properly. So sometimes you get 2 or 3 medication just because you are not using it properly.
And what is the danger or the risk of something like that?
That you can sometimes use medication that is not really necessary. You know, if you just use it properly, that when you go to the doctor, they can see, wow, the treatment is very well. So it's working. So we keep it like that. That's what you will have to use for the rest of your day.
Okay. So you're saying that it's important that we we follow the medications and take it the way it is supposed to happen. It's supposed to be used.
That's very important.
That's very interesting. Recently, I was in Africa, and I went with another. We met another lady who also came from here. Now, you know, we're supposed to take these tablets for anti-malaria tablets.
Yes.
But of course, we didn't have enough time to prepare all that. So we asked this lady, "Why did you bring your anti-malaria tablet?" He said, "Oh, no, I didn't." But this lady works in a hospital. And he said, "Well, but what you're going to an area that is supposed to be malaria infected? I mean, why didn't you prepare yourself?" You know, well, I know I stay in the hotel. I don't go into areas which have mosquitoes, so it's not a problem. So she kind of played out the whole thing. Now, do you think that somebody with such an idea is taking such a big risk?
You take the medication to prepare for if you get the malaria. But there are also treatment when you get the malaria also. So she's working in a hospital, so she can handle herself. She can handle herself. She don't have to check her blood. You have treatment for also when you already have malaria. So. It's up to her if she wants to take the risk. Normally, we prefer that way is more expensive too. For somebody who's not working in the hospital, because they will send you first to the hospital to let them check your blood to see. And those costs, if you're not insurance, is very high. So it's better to pay like maybe 80 euro, 50 euro before, and you use it, and you're protected. You protect yourself.
Well, if you're listening to this program and you have a question for Ms. Sulisa about your medication or the way your medication is reacting in your body, you can give us a call and ask the question to Ms. Sulisa. Wonderful, wonderful. Okay, so is it possible that people also become somehow addicted to a certain type of medication and they cannot do without it?
Yes, that's also possible, especially the sleeping tablets.
Okay. So if, let's say, a woman is going through menopause, and that comes also with difficulties to sleep. So there's the kind of sleeping tablets which is given. Does that become a permanent? Do you have to live on that, or it will correct itself?
I believe the doctor always will prescribe it temporarily.
Temporarily.
Yes. It's just for the situation at that moment. And and then they have to start using less.
Mm-hmm. So talking about drugs people become addicted to, tell us a bit more about that. You know, how does that happen?
Yeah, addiction. I don't see in pharmacy there is not so much situation with people addicted to drugs.
Mm-hmm.
There are those people who can use. There was on heroin and stuff like that.
Yeah.
That there was once a treatment that you give them like the methadone, you know, instead of the heroin because that's much better for them. But really addiction, yeah. Besides those sleeping tablets, but the doctor is very correct with those things. He has to prescribe it.
Oh.
They never prescribe it for 3 months. It's just only for 1 month, and sometimes only 15 days or 5 days. But that's something that the doctor will keep an eye on it. Yes.
Okay. Well, we will take a short break here. If you're listening and you want to give us a call, do that on 0207 37 1619. Let me repeat again, 020-737-1619. We're here in the studio with Miss Sulisa Matthews. Food are coming out. Please go ahead.
Yes. I want to let the community know that most of the time when they come in the pharmacy, they ask for paracetamol.
Yeah.
And that's just a painkiller. And the paracetamol, they think that the suppositoria, the one you put in the bottom, work better than the tablet.
Hold on one second, Miss. Hello, good morning, caller.
Good morning.
Oh, Mister, go ahead, sir.
Yeah, I would like to say the doctors are doing their best. The pharmacists also doing their best. But I have a problem here.
Yes.
Because they say lack of knowledge and people perish.
Yes.
I've been to some of the pharmacies. When they prescribe the medicine for you, go there, they try to explain a little bit to you. But some of them, because they see that a lot of people are there waiting, they just give you that is all. But some pharmacies, they will tell you, oh, what is temperatures is 4 milligram. I think you're supposed to have 8, so contact your doctor, you know? So they help you in that way. But some pharmacies, I don't know if the regulations are different. Work different, and some pharmacies also work different. So that is my problem. So what can they do about that, please?
Hold on, did you understand the question?
Can you repeat the question? Once more?
Repeat the...
She said the question is that many pharmacies don't explain because of the people who have queued up. They don't explain the usage of the medicine.
Okay.
But some pharmacies explain to you what this medicine is going to do. And then you know it and know that you can take it properly.
Okay.
That's what she's saying.
Yeah. Did you get the question?
Yes, I get a question
go
now.
ahead.
Yeah, I understand that some pharmacies don't explain how to use it very well. Yeah, the first thing is, especially here in Holland, the first thing is the language barrier. And sometimes when they come in the pharmacy and when people speak English, if you speak Dutch, I think the treatment will be very, the explanation will be better. But not everybody can speak English very well. And they expect in Holland that people speak Dutch. But in our pharmacy, we try to explain it anyway. So like I've just said, that yes, it is our job to do so. That when you come, we tell you what it is, we tell you what for it is, we tell you how to use it, and we tell you one of the most important side effects that can happen. And the second time, that's the first time, and the second time when you come, they're supposed also to ask you if everything is alright, if you have some side effects of some questions, and before you leave the first time, they also let you know that when you come, that if you have any question, you're supposed to just call and ask.
So do you make remarks on, let's say, a patient's use of medications, which, let's say, the doctor also has access to? As I assume that if you give medication to somebody who's been to the pharmacy, maybe you make your observations on whatever you gave them and anything you notice about their use of the medication. Now, does the doctor get a feedback on that, for example? Do you have any interaction with the doctor?
The doctor will not get a feedback from us.
Okay.
Only when there is a problem with the medication or something is something is not very clear,
Yeah.
we go to the doctor and ask him about it. If the doctor writes a doses and the doses maybe is too high
Right.
or too low,
Yeah.
that's something we go and ask.
Yeah.
Or we make some phone calls.
Okay.
But if the medication is working properly,
Yeah.
that's something between the doctor and the patient. Yeah.
Okay. Does it happen that the pharmacy makes a mistake in giving, let's say, either the wrong medication or the wrong dosage? Sometimes to patient, can that happen?
When people
Or
work,
maybe
always mistake can be made.
it can be made.
Yeah, so that's not out of the questions. Some things like that can happen.
Yeah.
But what you need to know is that when the prescription comes, one person will prepare it. A second one will do a check. And the pharmacist himself will do the last check.
Oh, so you mean when we come to the pharmacy with a prescription,
Yes.
all these things take place before the medicine comes to us?
That's why it takes so long.
Wow.
It takes so long because everything will be registered.
Yeah.
We cannot prescribe some medication that you have on prescription. Those medication we cannot give it without registration.
Yeah.
So most time we ask you date of birth. We put the medication in the system. The computer will tell us if the dosages are right or those medication you can combine them with what you're already using.
Yeah.
And you will tell me if you're late or not, or if it's the first time. A lot of information will come when I put the medication in the system. And then I go and I prepare it.
Yeah.
And there will be an etiquette on it with how to use it. My colleague will control, put also sign also that she check it is all right.
I see.
And then I will go back to you and I will tell you about it, how to use it and what it is for. And at the end of the day, every day, the pharmacy is the one who do the last check all the prescriptions.
Well, that's a lot of work.
Sometimes if something's not correct, he will make a phone call to the client, you know, and tell these things maybe it's not correct or the dose is too low. It's better to change it or things like that. So that's the way it works.
Okay.
So
okay. Can you just take the microphone?
Yeah.
Well,
So
there's a question here from the studio.
yeah. So does that, from your explanation, does that then mean when people say wrong dosage was given to a patient, and that leads to the death of that patient, then it means it's not correct, because if it is that the pharmacist checks everything every day, so the pharmacist is supposed to spot out when a wrong dosage or a wrong prescription have been given to a patient.
I will tell you
So
something.
what do you have to say on
Most
this?
of the time, people will not die from a wrong doses given by the pharmacy.
Okay.
You know, most of the deaths come from when people use different kind of medication and it's not registered in the computer.
Oh.
The good thing about the computer is now that we can just find out when some medication you cannot combine them.
Okay.
And if you have
That's very
another
good.
pharmacy, you pick some medication there, and you pick some medication somewhere else. And when you come to me, I don't know about those medications. That can be that you are using things that will not combine with each other. A lot of people enter in the hospital, you know, like tablet for stomach pain. The problem starts with the stomach pain. You can use some medication, and the side effects is giving you stomach complaints and or bleeding. Let's say the most important is the bleeding. You will not feel it. It will happen. So what we do is we give also some stomach protector that when you use that painkiller, it will just keep you safe.
Yes.
And sometimes most of the people can end up in a hospital just because they was using something without a stomach protector. You never know when that stomach complaint can happen. But normally now, in these days, they give standard, the painkiller and the stomach complaint. And it's not all the painkillers, it's some kind of painkillers that you need the stomach protector.
I see.
So,
okay, we run out of time now. Unfortunately, I think we have to bring you back because I think we're getting to some very interesting stuff here. We have to put on the news now. Well, I'd like to say thank you, Miss Sulisa Matthews, for coming this morning. We really appreciate the insight you've given. We hope you'll come back again to throw some more light and to inform our community. Yes. Thank you very much, and want to wish you a very wonderful day.
Thank you.
Okay, bye-bye.
It was my pleasure.
Thank you.